in other fields of medicine, sick people will come to you. Whereas here in the field of fertility, they come with a lot of mental drain. Having a good sperm count and a sexual life is not related.
In the society, a donor egg or a sperm or a donor embryo is not accepted by the couple. I mean, there's a mental barrier where they think that this child might not be mine genetically. How do you consult those couples?
So when there is so much acceptance for a blood donation, for eye donation and kidney donation, we all look up high about it. So same way, why don't you think about egg donation? Sometimes my team always thinks, they come and tell me in the back, "Ma'am, this is a donor egg." And I say, "Is it?" I can't even find out myself. The child was around 5-6 years and she told me, "Doctor, you know what? My son writes like me only. He holds a pen like me." Like, I was so happy. It was a donor egg child, but she was so identifying herself with the child.
And here I would also like to add that you're not a less of a man or a woman to not be able to produce an offspring. There are multiple options available in this world. Hello and welcome, dear listeners, to Fertility Tales powered by Nova IVF. I'm your host, Simrat. In every episode, we dive deep into the world of fertility, shedding light on the stories, struggles, and the science behind the journey towards parenthood. Today, we have a very special episode for you, which will provide as a comprehensive guide into a topic that is not often discussed but is very deeply significant: the use of donor sperm and egg in fertility treatments. Whether you're just starting out your IVF journey or are well into it, today's episode will be a treasure trove of information. I'm thrilled to introduce our esteemed guest for today. She's a beacon of hope for many, a pillar of knowledge, and an expert in the field of infertility. She has specialized in the field of reproductive medicine and has gone through training in Singapore. She is a consultant at Nova IVF, MRC Nagar, Chennai, and has over 25 plus years of experience and has helped 10,000 plus couples achieve their dream of parenthood. Dr. Krithika Devi, it's a pleasure to have you with us.
Thank you very much for giving me this opportunity. I'm very glad and privileged to be part of this awareness program.
Let's dive right in. Dr. Krithika Devi, with all the fields in medicine, what made you choose fertility as a specialization?
Reproductive medicine had always been my passion and dream. Right from my post-graduation days in JIPMER, I had always dreamt and was working towards going into the field of reproductive medicine. I feel creation of life, being close to the life being formed, is the most wonderful thing on earth. And if I can work on it every day, nothing more than that. So I would say I was lucky and fortunate to do my work, which is my passion.
That is truly beautiful, Doctor. Doctor, so in your fertility specialization, at what stage do couples come to you?
I don't get to see very easy patients, to tell you the truth. Right. So the patients who come to me are mostly at the fag end of their trial and error. So most of my patients are in their late 30s or in their early 40s. So that becomes a challenge for me because with advanced age, their egg numbers comes down. And men also do have problems. So when the sperm count is low, they don't approach a fertility specialist immediately. Most of the time, they take medications, they wait, and so they come to us at the fag end when the count is really low.
So, Doctor, with the stature that you are at as a fertility specialist, when do you think a couple should actually come for fertility treatment? When should they start consulting a specialist like you?
Thank you. It's a very useful question and practical question because majority of the patients think they have to wait for 1 or 2 years, and if it doesn't work out naturally, only then they should approach a doctor.
Right.
Although technically they say after 1 year, if a couple don't conceive, they have to see a doctor. I feel there are special situations where you need not wait for that particular period also. For example, a girl may have irregular periods even before marriage. She might have had endometriosis. She might have undergone surgery. So anything that had interfered with your menstrual cycle or so, it's better immediately after your marriage, please come for a consultation. We can just give you a counseling and guidance. Same thing applies to a man also. There are some men where in their childhood they would have undergone some surgery in their testicles, for example, undescended testes, or they might have had an injury in the testes. So, or they might be working in a profession where they're exposed to radiation, atomic energy. So, any man where there is a history of injury to the testicles or their work gets them exposed to exterior radiation need not wait whether they conceive, their partner conceives naturally or not. They can come immediately after marriage for a consultation. So that standard waiting of 1 year or 2 years is not required. I feel any couple, when they're planning their child, you can always approach us and get the guidance.
Yes, no condition should be overlooked and a
Yes.
consultation should be taken on time.
Especially, there are a lot of girls with PCOS nowadays with irregular cycles. So they would need an earlier guidance than to wait and then come to us.
That's truly insightful, Doctor. Doctor, can you describe the mental state of a couple when they come to meet you for the very first time?
Yeah. This is one unique field where in other fields of medicine, sick people will come to you. Whereas here in the field of fertility, they come with a lot of mental drain. Most of them are anxious, frustrated, depressed, and most of them would have lost hope whether I can become a parent or not. So the most important thing as clinician is to give them hope and positivism. So unless you bring them out of that emotional shell, the response to the treatment is not good. So we need to address their emotional component first and then start our treatment.
That's true, Doctor. When you come with that kind of a predisposed condition in your mind, a hopeful message is just great for you to carry on your journey. Let's dive right into our topic for today. When do you consult a person for a donor egg or a donor sperm?
This is a very delicate situation for any couple to accept a donor egg or a donor sperm. So we got to be very careful when we start the subject itself.
Right.
So in the first consultation, mostly I understand their issues and don't give them the dictum, no, you have to go for donor egg or donor sperm. So generally what I do is I give them options. For example, if the egg reserve is very low, I tell them you have an option of trying with your own eggs, but then the chances of success is only this much. Then the second option is donor egg, where you can have a better success rate, and I allow them to decide on their own. Instead of thrusting them on to go for a donor egg or a donor sperm, I tell them, if I'm going to try with your own egg or own sperm, then the chance of success is this much. When you go for a donor, the chances are better. So what it gives to the couple is they take time to decide for themselves. So most of the times, I leave them to decide and allow them to come to me and tell, Doctor, we have decided to go for donor egg. Then the acceptance and the progress is much better.
I think transparency is so important
Exactly.
in this. Doctor, for our listeners who don't know what donor sperm and donor egg is, could you spend some time explaining what both of these mean?
So what is donor egg is when a woman is probably in her advanced stage, say 40 plus, where her eggs are not there. So whatever injections we give, she may not develop a follicle or a oocyte. Or there can be younger women where genetically by birth they can have a condition called premature ovarian failure where they don't have eggs by birth. Or there can be women who have undergone surgeries on their ovaries. For example, endometriosis, they have lost their ovary or ovarian reserve. Or there can be a small segment of women where they had malignancies and they have removed their ovaries. So the only option left to them would be to go for a donor egg. So these are the situations where a woman may require donor egg.
And what about donor sperm?
Similarly, for the male counterpart, most men who have Azospermia, they may land up with donor sperm. But even for them, for men with Azospermia, we don't recommend donor sperm as a first option because with advances in the field of reproductive medicine, where we have testicular sperm aspiration, epidermal sperm aspiration, a lot of advances are there. So even for men with zero sperm count, we don't tell donor sperm as a first option. We give them an option of going for their own genetic material with testicular aspiration, and if that fails, if there are no sperms even after testicular aspiration, then the next option left to them would be to go for a donor sperm.
All right. And doctor, for our listeners, what is Azospermia?
Azospermia is a medical term which indicates the sperm count is nil. There are absolutely no sperms in the seminal fluid. But here I would want a small understanding for the viewers. Most of the people think sperm count is related to masculinity.
Right.
So if the sperm count is 0, they presume they cannot perform sexually also.
Right.
So, which is not true. A man can have 100 million of sperm, but still he may not be able to perform sexually. So, both are two different components. Having a good sperm count and a sexual life is not related.
Okay, that's very insightful for our listeners, doctor. Doctor, you mentioned donor embryo. The concept of donor embryo is very intriguing. Can you tell me, when do you advise the use of it?
Donor embryo is when you use both the egg and the sperm from a normal person. So donor embryo actually would be our last resort. I would say it would be the last AK-47 we take in our armamentarium when everything else fails. Because we at Nova do a lot of cell cycles. Our main priority is trying to give their own genetic child, which is a dream of every couple. So donor embryo would be the last option where there are problems with both the partners. For example, the lady may not have any ovarian reserve left with her, and the man may be azospermia, where his testicular biopsy also is negative. So as a last resort, we go for donor embryo, and there could be some genetic issues also. For example, they may have repeatedly kids with congenital deformities where nothing else works for them. And when we do a IVF with the pre-implantation genetic testing with their own gametes, we find all the embryos to be abnormal. And you don't want to land up with another abnormal child, then they may go for donor embryo. So donor embryo is a last resort before going for adoption. Here, compared to adoption, the woman experiences motherhood. She carries the child in her womb, she delivers, she feeds the child, so the attachment to it is much more. And in our Indian society, when a lady delivers and goes through motherhood, she feels more fulfilled.
Right. Doctor, what is the percentage of couples that come to you who could need a donor sperm or a donor egg or a donor embryo?
As I told you already, our main priority is working for, even if the AMH is very low, even with the egg numbers being low, our first priority is to try with our own eggs. But if it fails, say multiple cycles have failed, then we go for donor egg or a donor sperm for the male partner. So the percentage is very low. In my scenario, we get to about 10 to 15% of couples landing up with donor egg or donor sperm.
All right. That's very insightful, doctor. Doctor, one question is on my mind, that in this society, a donor egg or a sperm or a donor embryo is not accepted by the couple. I mean, there's a mental barrier where they where they think that, you know, this child might not be mine genetically. How do you consult those couples? What do you tell them?
Yeah, this is a very practical question that you're asking, and this question was in my mind also. So in the start of my career, I used to wonder, we are doing it for the couples, but how are they once the kids grow up? Is that pang is always there in their mind? So what I did was, I did a proper psychological survey with the help of a psychologist in Nova, where I had interviewed 25 couples who had the kids through donor sperm or donor egg, and had a survey with them privately, individually, both the women and the man. And I was so surprised at the end of our survey, where none of the 25 couples told we are missing our genetic child. I was really surprised, because for them, once a child comes through her, the women, and once a child grows up, they don't even think twice. So this survey actually gave me a boost and gave me a moral when I counsel my patients for donor. And for couple who are still very perturbed about whether to go forward or not, if they are willing, we have a support group system in Nova where we give counseling through a couple who have already gone through this process, if they are willing.
That would be really helpful for them to see some other couple who has already underwent that. Doctor, what do you say to these couples who actually want an offspring but also do not want to go the donor way? Are there any other options that they are willing to explore, and what are the options that you suggest to them?
Options.
Adoption, or are they willing to go ahead with that path?
Mainly the whole glitch lies in counseling them to accept this state when they are forced to enter it. So what I usually tell them for my patients are, see, you have heard about blood donation. When you need it, you don't feel bad about it. No, you feel grateful. Somebody is giving their blood to me, and don't even think twice from whom the blood is coming.
Right.
And we have heard about kidney donation, eye donation. So when there is so much acceptance for a blood donation, for eye donation and kidney donation, we all look up high about it. So same way, why don't you think about egg donation? So that is how I counsel my patient. Take it like a blood donation, where you're grateful and you go through the process without even thinking twice. So this egg donation is going to make your life more beautiful.
Are donor eggs and donor sperms typically used only in IVF treatments, or do you suggest them in IUI treatments as well?
Donor egg can be done only with IVF, because taking out eggs can be only with egg retrieval, which is an IVF process. But it is actually easier for sperm component, where if the couple needs a donor sperm, we can do with a simple intrauterine insemination, meaning where the donor sperm at the right time of ovulation will be just injected into the uterus with a simple plastic tube, which is very painless. So donor sperm option can be done with a simple OPD procedure, intrauterine insemination, IUID. Whereas if they have to go for donor egg, they need to go for IVF only.
Doctor, in the process of consulting a couple for a donor program, how has your clinic assisted in making an informed decision for the couples? I mean, how do they make an informed decision?
Whenever a patient goes through a donor egg or sperm treatment, it needs a teamwork. I alone cannot do much, because right from front office our care starts, because it's a very delicate issue. So we need to be very empathetic, and we should give them the privacy. So right from front office to my team of counselors, where we have a proper qualified psychologist who talk to them privately. They might extract things which even they don't share with me.
To talk to you about.
Yeah.
Right.
So the psychological background, and I have a clinician along with me who will give them a procedural counseling. So it's a teamwork, and it lands up with our embryologist who choose the right appropriate sperm for that particular couple. So it's entirely a teamwork, and I'm very happy to say that in Nova, we work as a team, and at every level we have qualified people taking care of the couple.
A collaborative team effort is very important
exactly.
for
It's
a
like
couple.
Cricket.
Right.
Everybody counts.
Doctor, a question on, I think, on most minds is donor program anonymous?
It was anonymous till our new ART law came in. So now the current ART bill encourages more of altruistic donation, where the privacy is no more required. The woman's relative can donate. But the most important criteria is the age. The age of the person who donates is very important, because they need to be less than 35 years. Because we all know more than 35 years, the quality of the eggs comes down.
A very pertinent question. How do you choose a donor?
Thanks for asking this, because most of the couples are so worried. We don't know what donor this doctor is going to give us, how our child will look. So first assurance that I give the patient is, we give respect to their choice. In case they're not going for an altruistic donor, they are going to get a donor through the hospital. I first give some time to understand what is their choice. For example, there may be a couple who say, we are very particular about having an educated donor. And there are couples who say, we want the donor to match our complexion. You won't believe, there are couples who told me, doctor, is it possible to get a vegetarian donor? So it goes on. I feel we should respect their choice. Right. So first thing is understand their expectation. We make a note of all the requirements, and my doctor see to that every requirement or the desire of the couple is fulfilled. I tell them, just give me some time so that I can fulfill your needs. So that's the first thing. And the second thing is physical compatibility. we look at the height of the recipient couple, like the couple who want the donor, the height, the color, and the blood group. So we try to match a donor who will not look starkingly different from the couple. So mostly egg donor means I focus on the women. So I choose a donor. Usually the donors come through the ART bank as per the current law. But ultimately, as a clinician, I get to see the donor, whether she will match my recipient physically. Then emotionally, my psychologist analyzes her privately, whether her IQ level is good. And we have a legal team who goes through all her papers, whether legally she fits into us. And I do a scan to see medically whether she's okay. Then we run a battery of blood tests to see whether she doesn't have any infection, whether physically she's fit to donate. So after all these speed breakers, we choose the right donor and then we go ahead with the process.
There's a thorough check in place.
Yes, medically, physically, mentally, legally.
And what about donor sperm, doctor?
Donor sperm, it's usually we get it from the bank, cement bank. So I don't get to see the donor directly like the oocyte donor. So here also we have specification. We give them the requirement, the height, what we require, the blood group, the complexion, and if there is anything else specific, that also will go in our request list to the sperm bank and we get the semen appropriately.
That's very interesting. There's a full thorough check and at the same time, they're able to map each requirement for the couple's need.
And most of the times I feel so thrilled, when the couple bring their kids to us after a donor program. Sometimes my team always thinks, they come and tell me in the back, "Ma'am, this is a donor egg." Then I say, "Is it? I can't even find out myself." So that is the effort of work that we put in so that the child matches the couple.
And that's very important. I think somewhere everybody wants someone that...
I understand.
Yeah. It's very interesting, doctor.
So our challenge lies in when they bring the kid to the hospital, it shouldn't look different.
With the introduction of the new ART law, what is the criteria of donating your egg or sperm?
This current ART law has regulated the whole workup of ART clinic and the practice. I would say it's like a traffic police. So the main criteria now what government has put forth is to protect the rights of a oocyte donor so that women will not be exploited. So according to the current ART law, a woman can donate only once in her lifetime.
And what is the age limit?
The age limit government has put forth is that the donor should be between the age of 23 to 35 years.
Okay, and doctor, is there a special criteria that she has to go through a multiple tests, etc. to...
All that we take care, because once a donor comes through, as I told you earlier, legal workup has to be done and medical workup. Then psychologically, we have to assess whether she's having a good IQ quotient, and the finance aspect, everything has to be taken up by the ART bank, and clinics don't involve in it at all anymore.
All right. So what is the age limit with the new ART law? What is the age limit for a person to go through IVF treatment?
I'm glad you asked the question, because this is something very important that has come up with the ART bill, where they put a age limit for a woman and a man to go through any fertility treatment for that matter. So the upper limit for a woman has been put as 50 years and for a man it is 55 years. So gone are those days where it was claimed as an achievement when a 70-year-old delivered her kids and it was a flash news in all the papers. Gone are those days. Here the rights of the child also is protected so that the child will have its parents for a longer time. So, and the women also will have their child when she's physically fit. So this age limit of 50 for women and 55 for men is something new that has come up in India. And it is essential for the couple to understand this and complete their family before that.
That's interesting, because the couple will need to be in their pink of health to bring a child into this world. That's very interesting, doctor. A technical query here, doctor. How many embryos are technically transferred in the IVF process?
We at Nova do not transfer more than 2 embryos. And I'm happy that now the current ART bill also supports the concept where they say don't put more than 2 embryos and 3 embryos only in exceptional situations. So the idea is to give safety for the women during pregnancy.
Right.
I'm sure in olden days, earlier times, you'd have always equated multiple pregnancies with IVF. You go to a shopping mall, you see twins, you just go near them and ask the women, oh, conceived through IVF. So like IVF has become synonymous with multiple births. And I feel the success of IVF is giving a singleton, healthy term baby. So multiple pregnancies, you see twins maybe nice to watch in movies and nice to see. But during pregnancy, with multiple pregnancy, the woman is exposed to higher risk.
And complications.
Yeah, she has a risk of getting higher blood pressure, higher risk for diabetes. And for the kids, they are exposed to preterm delivery and they have to be in incubators and preterm care for a longer time. So whenever my patient asks me, doctor, you put 3 embryos, I'll have better success rate. Put me 4, I just want to have pregnant. I just calm them down and say, it is not about having multiple embryos. It is about putting even one good quality embryo that will give you a safer pregnancy.
And a healthy pregnancy.
Yeah.
Right.
So I encourage a lot of singleton pregnancies, and only in situations where the lady has had multiple failures, we go in for 2 embryo transfers. So this is a concept I want the public to understand, that more is not healthy. Nature gives every woman a single baby. I think that's a spoon that will fit in that vessel. So
one baby at a time.
Yeah.
Could you shed light on the IVF procedure for a donor cycle? Is it too complicated?
Yeah, this is again a very good question. IVF itself, patients will be very worried. They think they have to lie down 24/7 throughout their pregnancy. A lot of working women are very skeptical about entering IVF. So for donor egg, I would say it's very, very easy compared to even a woman who wants to try with her own egg. For example, if a woman has to try with her own egg, she has to go through injections for 10 days at least minimum. Then there will be a small surgical procedure done under anesthesia where her eggs will be extracted through a needle. Whereas in comparison to that, if you're going to go for a donor egg, there are no injections, no surgery, no anesthesia. All you'll have to do is just take pills. It's only tablets, and the embryo, when we put it in, it's a OPD procedure. It's like a simple IUI procedure where we can just talk to her without anesthesia, transfer the embryo. It will take only 2 minutes. She can be in rest in the hospital for an hour or so. Then she can just go back home and resume her activities. So for donor egg, there is absolutely no surgery, no anesthesia, and it's all a OPD procedure done only with medications.
All right. So not very complicated, just a simple
Even
procedure.
after embryo transfer, there's no need for bed rest. They say a good embryo will implant whatever you do.
All right.
So a normal active life, they can continue even after an embryo transfer.
And that helps also keeping your morale up and just carrying on with your daily life.
Exactly.
Emotionally, some couples wrestle the feelings of inadequacy, wondering if they are any less of a parent when conceiving through IVF, especially the donor way. How do you counsel or consult such patients who come to you?
Usually I tell my patients, especially the women who's a bit perturbed, so I tell her, technically you are not going to have any difference. You are going to carry the child, deliver the child, feed the child. So for you, it's going to be like a normal pregnancy. So, and that emotional component comes automatically when you carry the child and deliver it. And I've seen a lot of my patients getting so attached with their kids after they come. I have my own doubts. What did I do to them? Self-egg or donor egg?
That's very interesting, doctor. Also, I think the bringing up is what that really matters.
Yeah.
For a child and a parent to bond and take those traits.
Exactly. I had a woman where she brought the child to me to show me. The child was around 5-6 years, and she told me, "Doctor, you know what? My son writes like me only. He holds a pen like me." Like, I was so happy. It was a donor egg child, but she was so identifying herself with the child. And interestingly, the child was so cute. She told me the child won the cute baby contest first prize. So it's not that when you go for donor egg, the child will not look good or anything. It's like how we choose the donor appropriately for them.
And also nature works its way
Yeah.
in a miracle. That's really interesting, Doctor. Doctor, continuing this conversation, what are some stories, some success stories that stand out for you, which are a humble experience and also helps you do what you do every day?
It is my patients, I feel, who teach me more than my books, especially the emotional component. As I told you in the initial part of my career, I was very reluctant and was really worrying how their life will be after they have their child. But after seeing a lot of patients enjoying being parents with their child through donor sperm or egg, that gives me a confidence to move on further in counseling my patients. So here I would like to share detail about a couple. Both were teachers. Both of them were in their advanced age, 40 plus, where I tried twice treatment with their own gametes, own egg, and the husband was having zero count. So I was using donor sperm with the lady's egg and it didn't work out for 2 cycles. So at the verge of which she was so depressed and disappointed, she said, "Doctor, I'm giving up. That's all. My life is doomed." And she was crying and so depressed. So I slowly broached her about the subject, about donor embryo. Anyway, you have gone for donor sperm. Since your age is 40 plus, maybe the quality was not good enough for you to conceive. So why don't you consider donor embryo option? So after a lot of counseling, reluctantly, she entered donor embryo program. And I took a lot of pains to choose the donor so that she will match the lady. So at the end of which, she wanted 2 embryos in spite of me telling one. So 2 embryos are transferred and she was blessed with twins, 1 boy and a girl. And they are now around 9 or 10 years of age. And every month, you won't believe, she sends me the progress card of the kids. Whenever the kid gets a prize, she shares with me. And both of them are so happy. I get to see the kids growing up. And every birthday, she used to call me and thank me. I feel that's a fulfillment of life.
That's wonderful, Doctor. It helps you
Exactly.
be there.
So seeing these
do what you
couples
do.
who enter donor program reluctantly, but who are very happy now without any negative thoughts, gives me the courage or the strength to counsel people who are waiting for donor sperm or donor egg.
And parenthood also teaches you
Exactly.
all the lights of life.
Yes.
Wonderful, Doctor. Lastly, in your vast experience, have you seen a shift in perception of donor sperm and donor egg? Has the society evolved over time regarding this, and what's the acceptance like?
Definitely, I could see a positive shift towards acceptance of donor egg or sperm compared to the earlier times. One, the reason could be awareness. Especially our media and programs like this gives an awareness to the couple that there are options. There are ways and means to have their parenthood day. That is one thing. And second thing is, in India, although we are the most populous country in the world, when you don't have a child, the burden on the women is very much more. So parenthood is equated to femininity for a woman. So they are prepared to go to any extent to carry a child and deliver. So that is another reason for the increased acceptance level in our society. And another interesting observation that I have seen is women are more ready for donor egg than to accept a donor sperm.
Wow.
When there is a situation, I see women willingly telling, "Doctor, we'll go for donor egg, but try to do with the sperm of my husband." So that is an observation that I have seen. And yes, there is more and more acceptance towards donor programs because the next option left to them is adoption. So before that, they are happy to carry the child and deliver, and the social pressures on them will be lesser in this way.
Right. And here I would also like to add that you're not a less of a man or a woman to not be able to produce an offspring. There are multiple options available in this world. Beautiful, Doctor. Dr. Krithika Devi, your insights have been so valuable today for someone who is looking out to explore more options in their fertility journey. And I'm sure the listeners have also got enough and more information on how to go about navigating their fertility journey if they have to take about a donor cycle. Thank you, Doctor.
And thanks for this opportunity because this donor program is a very delicate subject. A lot of people would be very reluctant to even ask about it. So I hope this program would have thrown light on it. And I want to tell my people who are living with the dream to have their child, never give up. When all door closes, there's always a window open for you. So all the best for all of you. Please pursue your dream. Thank you.
To our listeners, thank you so much for tuning into Fertility Tales powered by Nova IVF. Please don't forget to like, share, and subscribe. Spread this message to anyone who needs the resources and the information, who is embarking on their journey towards parenthood. Until next time, this is your host Simrat signing off, wishing every couple some clarity on their journey. Thank you so much.